One of the more challenging aspects of periodontal surgery is performing an osseous resective surgery on lower molars. This is in part due to the prominence of mylohyoid ridge in the posterior lingual sites. As you can see in this cross-sectional view, as I scroll through the slices posteriorly, the mylohyoid ridge becomes more prominent and becomes a challenge in performing ostectomy and osteoplasty back here. Mainly it's because what lies in this area, the vital structures of lingual nerve and lingual artery. But in order to achieve a good apical position of the flap, you must perform osteoplasty of the lingual, and you must get rid of the sharp ledges in the apical region without damaging the nerve or the artery. You do that by first elevating a full thickness flap and protecting the flap with a retractor. Here I'm using a Pritchard retractor, but sometimes when dealing with a large tongue, I have to resort to using Minnesota, which is really not made for the lingual, but its broad handles keep the tongue out of the way. It's really important to protect the flap, especially when you're using a handpiece. But lots of times, a limited flap access and strong tongue makes it difficult to safely use a handpiece all the way apical and distal. One way I get around that is by doing the osteoplasty with the handpiece as much as I can, then removing the remaining apical ledge using a bone file. Bone file is safe to use under the flap without having to retract at the same time. This gives you access to the tight spaces back there. Bone file is used in a back and forth motion, and because there are no sharp edges, you can safely use this bone file under a flap, and you can even tunnel a little bit with it. Everyone should keep a bone file in their osseous kits because this is such an effective and efficient tool. Trust me, bone files will make these procedures safer and you'll get it done a lot faster. For more surgical advice, please follow my channel.